Hello, hello. Welcome, everyone. I'm Dr. J.R. Crochet, Center of Reproductive Medicine in Houston, Texas. Just want to say welcome. This is one of our sessions, one of two sessions today, and one of several sessions of the week where we're recognizing National Infertility Awareness Week. We've had a really fun week. We've had lots and lots of things going on. On Monday, we had our doctors, Catherine and Dr. Perfetto, who talked to us about preparing for pregnancy during the quarantine. They did that via Instagram. On Tuesday, we had one of our partners, Breathe Big, come in and work with our patients doing a breathwork session. That was a lot of fun. Yesterday on Wednesday, Dr. Schnell did a talk on what to expect with telemedicine. So this is a big thing. This is something that we're doing a lot of these days. And so telemedicine is going to be a big part of medicine going forward. So Dr. Schnell talked with us about what to expect with that. She also repeated that session today via Facebook Live, so you can certainly look back at our Facebook feed and pull that up and look it over and ask questions. We have a lot of things still scheduled for this week, and I'm excited about, especially tomorrow. We have a big day tomorrow. We have one of our friends, Claire. She teaches yoga at Bergamo's retreat. She's going to be doing a Zoom session where she goes over fertility and pregnancy yoga. So super excited about that. Dr. Catherine is going to connect with our patients and followers again via TikTok Live tomorrow afternoon around lunchtime. And then tomorrow evening, our in-house psychologist, Dr. Christian Chambliss, is going to go over coping with all of our patients. So a lot of really, really exciting things this week. We're going to conclude it on Saturday with a special message from the quorum physicians, and then also some giveaways. So all week long, as people have been logging in and watching these sessions, there's been opportunities for you guys to enter in for some really cool swag. We have several packages valued at about $500 that are going to go out to some folks, and so you can look across all of our social media platforms to get registered and to have opportunities to win those. So good luck. Be sure that if you do post in social media, and there's been a schedule this week of things to post, do tag that with my infertility story. That's one of that is the theme of National Infertility Awareness Week, NIAW. And so also tag it with NIAW 2020, and then also Quorum, Center of Reproductive Medicine. And then our tagline is One Goal, Two Lines. You can find Quorum on right here on Facebook, also on Instagram at Infertility Texas. That's also our website, www.infertilitytexas.com, and then on Twitter as well at QuorumTX. You can find me on Facebook as well, or on Instagram at JRCROCHETMD. And I look forward to having discussions with you guys about any questions that come up from this session, or anything else that comes the rest of the week. So with that, today I want to talk just briefly about one topic in general, and it's general infertility, health, and well-being. And so this isn't meant to be an exhaustive, thorough discussion. It really is just a discussion of some of the general topics like nutrition, exercise, vitamins, habits, and then just psychological and mental health and well-being. So first with nutrition, I'll say this. I'm not a fan of crash diets. So I am not a fan of somebody doing something that is not going to be sustainable for them. So what I prefer is that we have a lifestyle nutritional plan. And in general, a very, very healthy diet is one that's balanced and that we get all of the macronutrients. All of these are important for fertility. So we have to have carbohydrates, we have to have fats, and we have to have proteins, right? So our carbohydrates should be complex. They should come from healthy sources like vegetables, fruits, and whole grains. Fats, there are a lot of healthy sources of fats, avocados, tree nuts, olive oil. Proteins, we mainly want to be lean meats. So like chicken and fish, we try to avoid red meat as much as possible, as good as it is. There's a greater risk of contamination with those meats, with those protein sources. So we try to limit those as much as possible. Eat healthy, eat organic as much as possible. There are some things that are absolute must. You must avoid sodas. You must avoid fast food, and you must avoid processed foods and really just eating out as much as possible. You can always get healthier options at home. I really recommend that that's the route that you go. There's a couple of specific diets that I want to touch on real fast. I think there's some real merit to something like a keto diet. Again, I'm not convinced that it's something that's sustainable, but I've had patients, especially with conditions like PCOS, who respond very well, and they have weight loss, and things like their insulin resistance get better and their fertility improves. So although it's not my favorite, not my go-to, it's certainly something that I'm supportive of. And the same can be said for a plant-based diet. Again, it's not my favorite. I believe there's a lot of merit to support the health benefits of a plant-based diet. So that's something that, in the right person that desires to be healthier in that way, I fully support that. My favorites are things like the Mediterranean diet, which has actually been shown to improve various metrics of fertility treatments like IVF. And then also my personal favorite are things like paleo and Whole30. I've had some patients have really, really good success from the standpoint of fertility improvement with those kinds of diets. And again, there's no one diet, there's no one nutritional plan that's a fix-all for all patients across all types of fertility issues. You really should find a plan that works right, that works best for you. So one of the things that comes up a lot in the consults are vitamins. And certainly there are vitamins that you should be on prior to pregnancy. Because of all of this COVID stuff, there's some additional vitamins that I want to go over that may improve immunity. But in general, any type of prenatal vitamin, multivitamin, women's one a day, all these kinds of vitamins are going to have what a woman needs prior to getting pregnant. And my male patients, same thing. A men's one a day generally is going to be good for the majority of circumstances. Women should have at least 400 micrograms of folic acid per day. Most prenatal vitamins and most women's one a days are going to have that, but check the back of the bottle and make sure. The calcium, again, most of them are going to have the amount of calcium that you need. I've found that lately a lot of them, or some of them don't. So make sure that you're getting at least 1,000 milligrams of calcium per day. And then also vitamin D. So vitamin D is interesting because before all of this COVID stuff, I was a big proponent. I check vitamin D on a lot of patients, really most of them. And I find that many of my patients are deficient in vitamin D. And so usually I right off the bat, I'll put people on 2,000 international units of vitamin D per day. But now with this COVID stuff going on, there's some evidence to suggest that as much as 4,000 to 5,000 may be needed to improve immunity. And so I'm not necessarily saying that would prevent COVID. I'm just saying if these are things that we're wanting to do that may help improve our immunity, that's something to consider. For women that are older than 35, and for women who are known to have diminished ovarian reserve, something that's been diagnosed by their OBGYN or their fertility doctor, there are a couple of vitamins additional vitamins that I would recommend. So one of them is CoQ10. There's a lot of studies out there about CoQ10, and the evidence is, there's some studies to suggest that it's helpful. There's some studies to suggest that it's not. But in general, taking about 600 milligrams a day should is what's recommended. Okay. And I really believe there's little downside to CoQ10. So it's something that I think is reasonable. And those women 35 and older, diminished ovarian reserve, they can go ahead and add that on to their regimen. Another one that we prescribe in a lot of circumstances of diminished ovarian reserve is DHEA. And so this is one that I would recommend that you take that under the direction of a physician. There's some circumstances where that may not be desirable. So definitely check with your doctor for that particular vitamin. With all this COVID stuff going on, there's a couple of additional vitamins that may also improve immunity in addition to vitamin D. I want to go over those real quick. Vitamin C, 5 grams a day. N-acetylcysteine, 600 milligrams a day. Glutathione, 500 milligrams a day. L-lysine, 1,000 milligrams per day. And elderberry syrup, 1 teaspoon a day. So understand that there's a lot of unknowns with these, but there's some evidence to suggest that these particular vitamins may improve immunity. And there's also pretty good evidence to suggest that at the very least, they don't harm fertility or health. So exercise. So this is a very, very common question. In general, we should be getting about 45 minutes of moderate intensity exercise about 5 to 7 days per week. So a lot of people ask, okay, well, what is moderate exercise? Well, I can tell you it's a lot of different activities to differentiate that from vigorous exercise. Vigorous exercise would be any activity that holds you at near breathlessness. So really what's recommended for a man or a woman who's trying to conceive is to have moderate exercise. That's what's been shown to improve fertility. There's some evidence to suggest that people who are overweight, a BMI of 35 and greater, that doing vigorous exercise 5 to 7 days a week may actually improve fertility. So depending on your BMI, that would dictate the level of intensity of the exercise that you need to be doing. So one of the questions that comes up too is can vigorous exercise harm fertility? And there is some evidence to suggest that vigorous exercise in the normal weight person may slightly reduce fertility. So I will say this, in the last probably 5 or 8 years, I've really only had about 2 patients that I was convinced had decreased fertility because of their amount of exercise. So in general, I tell my patients to get after it and do what they feel comfortable with. So habits, right? So habits are things like alcohol, tobacco, recreational drug use. I will say that in general, there's a lot of unknowns. There are studies to suggest that certainly tobacco and certain recreational drugs decreases fertility. So certainly would recommend, if that's something that you're doing, don't. Alcohol, there's just so much that's unknown about it, but I will say that there's really no studies to suggest that fertility improves with alcohol. So, and it's certainly something that you wouldn't be able to continue once pregnant. Just cut back and plan to stop when the fertility treatments begin. Sorry, I just got a text from someone and was as it pertains to this, and was just checking on that. So emotional, psychological, and mental well-being, I'll say this, there's no secret sauce here, except for rest. Get lots and lots of rest. And then outside of that, do what you enjoy. You get rest, find peace in some way. For some people, that is exercise. For others, it's reading or yoga or meditation. For me, it's listening to music. So do what makes you tick. In this time of quarantine and staying at home, be sure to stay connected. We have all these fabulous platforms and mediums to stay connected. So I would advise that all of you guys do that. And that's really all I have for today, guys. Listen, it's been a lot of fun. I hope it's been helpful for some of you. I hope that it starts a discussion with either me or your fertility doctor. I will say this, I look forward to the rest of the week. We got lots of fun things planned. So I look forward to that, and see you soon.